Hello everyone, how are you guys doing? This is Dr. Maha Waqar and you are watching Versatile Maha. So guys, today I'm back with another health video of mine, and today we'll be discussing about human papillomavirus vaccination, HPV vaccination. So what exactly is HPV? Like I said, human papillomavirus, which is transmitted by sexual intercourse or oral sex. So this is going to be today's topic, and it's going to be pretty interesting and very knowledgeable. So guys, stay with me till the end of the video and share it as much as possible. And if you haven't subscribed to my channel yet, then do subscribe it and hit the bell icon. So guys, like I said, HPV, human papillomavirus, and it is the most common cause of cervical cancer in women. And you will be surprised to know that cervical cancer is the most common cause of death in women here in India, and second most common cause of death worldwide. So if you're talking about statistics, then around 75,000 deaths per year in India because of cervical cancer, and around 2 lakh deaths per year worldwide because of cervical cancer. So cervical cancer, how do we need to prevent? Basically, first of all, to prevent cervical cancer, we need to prevent HPV. So what are the symptoms of HPV? HPV usually do not have any symptoms. It is in the very dormant stage in our body, in both males and females, and whenever it expresses itself, it expresses in the form of genital warts or anal warts. So that is also very rare. And eventually what happens is it remains dormant, and in around 4th to 5th decade of life here in India, usually cervical cancer expresses itself, and in developed countries it usually expresses in 5th to 6th decade of life. So guys, what are the symptoms of cervical cancer then? What happens is cervical cancer usually presents as irregular bleeding between to menstruation and during menstruation, very heavy bleeding, pain lower abdomen, back pain, and pain during sexual intercourse, which is called as dyspareunia, and vaginal discharge, very foul smelling vaginal discharge, like I discussed in my last video. So these are the symptoms of cervical cancer, and usually when these symptoms appear, it is a little late for the person to treat the cancer. So what is the investigation for cervical cancer? Investigation comes to routine blood test, then ultrasound, and most important, that is pap smear. So these are the investigations which person needs to get done, definitely, pap smear being the most important. And apart from that, apart from the investigations, what are the treatment options? Treatment options are quite limited: surgery, chemotherapy, and radiation therapy. These are the options for treatment purposes. And let's talk about how to prevent cervical cancer. Now, prevention of cervical cancer means you need to prevent human papillomavirus infection, HPV infection. And what do we need to do to prevent HPV? Vaginal hygiene, very, very important. Like I discussed in my last video, if you guys would have seen, I've discussed there how can you maintain vaginal hygiene. And apart from vaginal hygiene, monogamy is very important. Single sexual partner, women usually who have single sexual partners have very less chances of developing HPV as compared to women who have multiple sexual partners. And apart from that, most important, vaccination. Vaccination is, because what happens is once a person develops HPV, it is very difficult and almost impossible to treat the HPV infection itself. There could be symptomatic treatment, like one can treat genital warts or bleeding or discharge, whatever it is. Local treatment can be there, but HPV infection as a whole cannot be treated. So the best way to prevent the infection is get the vaccination done. So the vaccines which are used for HPV are Cervarix and Gardasil. Gardasil vaccine is more frequently used because it covers more strains of HPV. It covers 4 strains, that is 6, 11, 16 and 18. So Gardasil is one vaccine which is given to both girls and boys in Western countries. But here in India, we are giving it to girls only. So what is the age group? And age group is usually 9 to 14 years of age, and this is the best age to be for the girls and boys to be given the vaccine. So in the age group of 9 to 14 years, 2 doses of HPV are given 6 months apart. And if we are giving vaccination in the later time, like between 14 and 26 years of age, then the person is supposed to be given 3 doses, 0, 1 and 6. That is, the gap between the first and second dose is 1 month, and the gap between the first and third dose is 6 months. And after 26 years of age, people usually take it, but then it is not as effective because the woman is already or the guy, both are already exposed to the HPV infection most of the time, so it doesn't play that important a role in prevention of HPV. So that was about the schedule and age group of vaccination. And apart from that, what is the cost of vaccination? It is a little expensive vaccine. Usually the single dose of vaccine is costs between 3,000 to 3,500 Indian rupees. Earlier it was around 2,800, but now recently the cost has increased. So it is quite expensive, but again, it is worth it. And usually some people here in India are a little skeptical about the vaccination as to what would be the side effects and should we get it or should we not. So the answer is the side effects are as simple and as similar to other vaccinations. Usually on the site of injection, intramuscular injection they are giving, so usually it is pain and redness on that area. So that's it. Very limited side effects, no serious side effects as such. So that's it guys, this was all about HPV and HPV vaccination from my side. I hope you guys found this video helpful, and if you did, then do share this video as much as possible so that we could spread the awareness. And stay tuned with me for next fun video of mine, and I'll see you guys with another fun video, and take care you guys. Bye bye.